Question 5 from the 2024 Italian Medical Specialty Entrance Exam with shuffled answers. Pause the video before I answer, and then I'll explain step by step. A 55-year-old man presents with an episode of hematemesis. Besides blood tests, which examination should be performed first among the following? Pause the video before I start the answers. A. Abdominal ultrasound. Alright, an abdominal ultrasound would be useful in evaluating solid abdominal organs, for example, the liver, the gallbladder, pancreas, but it is not adequate for visualizing the inside of the upper gastrointestinal tract or identifying the source of the hematemesis. Answer B. Abdominal pelvic CT scan. So CT scanning can actually be useful in certain situations, but in acute hematemesis, it is not the first line examination. Plus, the CT scan does not allow for immediate therapeutic intervention at the bleeding site. So I would say that answer B is also incorrect. Answer C. Gastrointestinal X-ray with water-soluble contrast medium. So, this test is mainly indicated to evaluate perforations or fistulas. It is not appropriate in active bleeding because the contrast medium can interfere with subsequent endoscopic procedures. So also C is not correct. Answer D. Esophagogastroduodenoscopy. So D could be valid. So we have hematemesis, so vomiting blood, which indicates bleeding in the upper GI tract. So we're talking esophagus, stomach, or duodenum. So if it's the upper GI tract that we're suspecting, an EGD, a gastroscopy, esophagogastroduodenoscopy to be precise, would be the first choice because it allows direct visualization of the upper GI tract mucosa and identification of the bleeding source. Also, the immediate endoscopic therapeutic intervention that would be necessary if we deem so. So I would go with answer D, but let's look at the last one. Gastrointestinal X-ray with barium meal. Well, the use of barium is contraindicated in acute gastrointestinal bleeding because it could essentially mask the bleeding source, therefore complicating further diagnostic and therapeutic procedures. So you definitely don't want to cover the blood with an external source or medium. So yes, answer D is still correct, and that was also the correct answer in this year's exam. Alright, now let's make up a question that is more difficult, but similar in context. A 60-year-old patient with a known history of liver cirrhosis presents to the emergency department with an episode of massive hematemesis and melena. Physical examination reveals hypotension, tachycardia, ascites, and signs of hepatic encephalopathy. What is the most appropriate next diagnostic and therapeutic step? Pause the video, because now we will begin answering one by one. Answer A. Administration of octreotide and IV antibiotics followed by urgent EGD. Well, right off the bat, we got our winner, because in this situation, sounds about right, to be honest. We have liver cirrhosis and signs of portal hypertension, which increases the risk of bleeding esophageal varices. We have massive hematemesis and melena, which indicate an upper GI tract bleeding. We have hypertension and tachycardia, which, again, here we have definite signs of hemodynamic instability, so we have to be quick. So we need immediate intervention. We go with octreotide, which is a somatostatin analog that reduces the splanchnic blood flow and thus also the variceal bleeding. Then we hit it with some IV antibiotics to prevent bacterial infections that could complicate cirrhosis during a bleeding episode. And last but not least, an urgent EGD. We gotta go for scopy because it is necessary to diagnose and directly treat bleeding varices through ligation or sclerotherapy. That's under the discretion of the specialist, of the gastroenterologist that is on call. Well, that spoiled the fun, I guess, for all of us, but hey, let's just look at the next answers to see if they could have been close. Answer B was transfusion of fresh frozen plasma to correct the coagulopathy. You want to correct coagulopathies that may be necessary, but alone, it is not sufficient. It does not directly address the bleeding source nor stabilize the patient. So the answer is not correct because it doesn't give all the steps we need to follow, all the different procedures we need to do like the previous answer did. So no. Answer C, performing an abdominal CT scan with contrast to evaluate the portal vein. It's an emergency. We have to manage an active bleeding. The CT scan does not offer immediate therapeutic possibilities, so no. D, placement of a nasogastric tube to monitor the bleeding. Placing a tube, this may confirm the presence of bleeding, but just confirming it by doing it this way, it risks worsening trauma to the esophageal varices and offers no therapeutic benefit. And remember, this is an emergency. We're running out of time. We need to consider treating first. So D is not correct. Last one, initiation of aggressive diuretic therapy to reduce ascites. Managing ascites is always important, but not a priority at the beginning when we have an emergency. It's a hemorrhagic situation. You got to treat that first. So yes, A was the right answer, no doubts. And thank you for your attention.